COVID-19 hit communities of color especially hard, and now that hospitals are seeing cases spike, some community organizations are back on the front lines. For Pastor Edgar Vergata, this is what it means to take care of his community. Long lines of cars wait for assistance as his organization, La Semilla, holds its weekly food drive while raising awareness as COVID cases spike.
The concern is definitely there, and that means that we need to make an emphasis.
That emphasis looks like passing out COVID tests and asking if community members are up to speed with vaccinations.
The virus, even though it is not as mortal as it used to be, will spread in a way that will affect our communities and our families.
It's a real concern for Magdalena Serrano, who picked up the last 2 COVID tests at this food distribution.
Her older son that goes to school has lately been having cold, flu-like symptoms, or coughing and cold-like symptoms, and she's concerned.
Pastor Vergata translated her words as she told me what would happen if her husband caught the virus again.
Him not working a whole week means we don't have the money that's needed to sustain a family, get food and basic needs.
It will be really important that we get these communities protected as soon as possible.
Dr. Rashida Monroe is a Wake Med pediatrician and a member of the Sister Circle. It's a group of Black female doctors that formed at the height of the pandemic to close the racial gap in COVID vaccination rates. And with a resurgence in cases, she says marginalized communities are more likely to have untreated chronic conditions and less access to insurance.
That could be a bad confluence of factors. Those two things together could lead to increased hospitalizations, sicknesses.
And that's why the work continues. Tonight, the group is holding a town hall at St. Aug to continue raising awareness.
It's time for people to start thinking about how they will begin to protect themselves again.
In Raleigh, Akila Davis, ABC 11 Eyewitness News.